Welcome to the new edition of Medical Discoveries. Today, we will be talking about platelet-rich plasma, which is commonly known as PRP treatment, as well as stem cell treatments. Now, we are not talking about embryonic stem cells. I know there has been a lot of controversy about that. We are not talking about embryonic stem cell. We are talking about adult stem cells, your own stem cells, because every tissue in your body does have, or I should say almost every tissue, does have stem cells that can be harvested and used to heal and regenerate your tissues. This has been in news because a lot of the professional players like NFL players, NBA players, PGA Tour golfers, they have been using this. Not only these treatments are effective, the most important reason why these treatments are so popular for orthopedic conditions of your back pain, spine, arthritis, any joint problems is because not only they cause healing, but the healing occurs without scar tissue. Now that does not happen in orthopedic surgeries. The recovery therefore is faster as well as is closer to what it was before you were injured. So let's explore more about the PRP and stem cell treatments.
I know a lot of patients have concerns. Is this procedure painful?
Well, that's a very good question. A lot of patients who come in, they ask this question. This is not painful. And you feel a little discomfort, depends on which area we're doing. First of all, I need to mention this is a outpatient setting procedure. So you do it in the office, it's done as an outpatient, and it's not done in the hospital. So people come in and then they're done within an hour to 2 hour maximum. Depends on how many joints and how many areas we're doing. And they go back home, and they certainly next morning they return to their work, their activities, normal activities. Now before they come in, we give some medications to calm them down and some pain medications. While they are here, we use some numbing medications, injections, local medications in the joint or in the back. So you don't really feel any pain, so.
Now I have a lot of patients ask me, is this procedure covered by insurance?
Now that's a very good question. This is at this point is not covered by insurance. Now overall what we do in outpatient setting is not covered by Medicare or any other insurance. Now PRP has been approved in certain conditions and the Medicare will pay for that if it is done by orthopedic doctor during a surgery, as a part of a surgery. Or I think if recently they also approved for wound care for diabetes. But for most part, for what I do, PRP and stem cells, adult stem cells for back pain, low back pain, neck pain, joints, arthritis, or joint injuries of the knee, hip, shoulders. For most of that, it's really not covered by insurance company, unfortunately, at this point.
Now, Dr. G, are there any harmful side effects?
Well, a lot of patients are worried about those things, and there are really no serious side effects. Obviously, any procedure we do, there are always side effects, but from adult stem cells that we have been talking about, those adult stem cells and PRP do not have, especially using in joints outside. We're not injecting in the heart or in somebody's brain or something. We're injecting outside in the joint and back. There have not been any reported side effects.
Okay.
Certainly not long term, because one patient I remember, she asked me, I want to make sure I'm not going to grow extra finger from my knee or something, So no, that doesn't happen. Now short term you can have small little swelling or itching or irritation, those things. The most important thing I can tell you as a physician in these procedures to remember is this, that we are using your own tissue. We are using tissues from your own bone marrow. We're taking a little bit of fat cells out in your own blood, and number one, we are not storing it. We are not manipulating these tissues, any of those. We are not sending it out. We are not adding anything into it, and we are doing it everything right in front of you. And therefore, we don't have any chances of rejection, and for most part, done properly, don't have any side effects of infection or any other serious damage. So does that answer the question?
Yes, it does.
Good.